Good morning, and thank you for tuning into today's webinar. My name is Allan Pantuck. I'm a professor of urology at the David Geffen School of Medicine at UCLA and a member of the Institute of Urologic Oncology. And we're going to talk today about something called Provenge immunotherapy. And what we'll do is we'll talk a little bit about prostate cancer, and then I'm going to give a little bit of an overview of what immunotherapy is, and then we'll specifically talk about this particular form of therapy. It's an FDA approved vaccine cellular therapy that's available for men with advanced prostate cancer. So my talk will be about 20 minutes in length, and we'll have some time at the end for questions. And all questions can be submitted using Twitter, using the hashtag UCLAMDChat. So it goes without saying that cancer is a significant health burden here in the United States, that many men and women are affected. Over the last decades, there's been a significant increase in the number of people with cancers. This year, it's estimated that approximately 600,000 men and women will die of cancer. And by 2044, cancer, it's estimated, will become the leading cause of death. Currently, it's the second leading cause of death behind cardiovascular disease. Within the wider spectrum of cancers, prostate cancer is quite common. It's the second most common cancer among American men. About 1 in 6 men will be diagnosed with prostate cancer. Many men who are diagnosed are treated with surgery or with radiation, and the majority of these men can be cured of their cancer. But 1 in 3 have a recurrence of their cancer following their initial treatment. Once the cancer has recurred, it's common to put men on a hormone therapy. That's the standard of care. And of men who start this hormone therapy, about 4 in 5 eventually have further progression, develop what's called metastatic disease, what's called hormone refractory disease. And this is a form of not localized but advanced prostate cancer. So even with appropriate treatments, as I said, the most common treatments would be either surgical removal of the prostate or various forms of radiotherapy. Even with these therapies, cancer can progress from an early stage to an advanced stage. Often when it's early and localized, prostate cancer doesn't cause any symptoms. When it's advanced, people can develop symptoms related to the spread of their cancers. In the last 5 to 10 years, and particularly in the last 5 years, there's been quite a few advancements and drug approvals in the United States, which are significant treatment alternatives for men with advanced prostate cancer. We've had several forms of chemotherapy that have been approved in the last 10 years. We've had, just in the last few years, 2 new drugs that are considered hormone therapies for advanced prostate cancer. And prostate cancer is one of the few types of cancer where we've had something called immunotherapy. Now, immunotherapy is a type of treatment that's not radiation, it's not chemotherapy. It's basically a way of using the patient's own immune system to seek out and to treat their own prostate cancer. So what is Provenge? How does it work? Provenge is an FDA-approved treatment. As I've said, it's an immunotherapy, and it's a personalized therapy. And the goal of personalized therapies, such as an immunotherapy, is to provide a safe and effective way to treat patients, and in this case, to treat patients using their own immune system. Provenge is an autologous cellular immunotherapy, and what that means is autologous means it's a treatment that's derived directly from each individual patient, and it's indicated for the treatment of asymptomatic or minimally symptomatic metastatic castrate-resistant prostate cancer. And again, this is the form of prostate cancer that's spread outside the prostate and that has stopped responding to hormonal therapies. So just to give a little bit of background, cancer has a number of features. This is a famous paper published in 2011 that enumerates many of the features of cancer. So cancer has the ability to grow its own blood vessels. Cancer has the ability to grow without restrictions. And one of the features of cancer that has become evident in the last few years is its ability to avoid the immune system. And this is really considered a hallmark because we believe that the immune system is able to recognize and often prevent cancers from developing or prevent them from growing and spreading. So it's the ability of the tumor to avoid what we call immune surveillance that is one of the key features of cancer. And we believe this is a dynamic process. The immune system can either suppress tumor growth and development, or under certain circumstances can allow tumor growth. And again, this is a dynamic process. The body tries to control the tumor. The tumor can sometimes do things to evade or outgrow the ability of the immune system to recognize and control it. The National Cancer Institute has a definition of immunotherapy, and this is essentially any treatment that boosts or restores the ability of the immune system to fight cancer, to fight an infection, or to fight other diseases. So if you can think again of this being a balance between immune protection and immune evasion, immunotherapy is a process where we increase the ability to provide immune protection against cancers. Immunotherapy is actually not a new thing. The origins of immunotherapy go back to the 1800s, the late 19th century. But from a clinical standpoint, particularly when we think of urology, even going back to the 1970s, UCLA's urology department has been actively involved with various types of immunotherapies for different types of cancer. So we were one of the first places to investigate the use of BCG in bladder cancer. BCG is a type of bacteria that's used as a vaccination against tuberculosis. It's now a standard treatment for bladder cancer. In the 1980s, we began investigating cellular therapies, part of the use of what's called white blood cells to treat kidney cancers. In the 80s, again, we were involved in the use of interferon for kidney cancer, involved in the use of interleukin-2, which was approved in 1992 for advanced kidney cancer. And over here we have, in 2010, the first cellular therapy, what's called Sipuleucel T, or Provenge, which is the brand name. And this was finally approved in 2010 as a treatment for advanced prostate cancer. UCLA was involved in the studies that led to the approval. And we've actually been giving men with advanced prostate cancer Provenge basically since 2003. So for over 10 years, this has been a treatment available through the UCLA Urology Department. So even though the origins of immunotherapy go back over 100 years, it's really only recently that both the basic science of immunotherapy, our understanding of the immune system, as well as the clinical results that have been achieved when immunotherapies have been tried in patients, has led to now, in just 2014, the most prestigious science journal, Science, declaring that 2014 is now was the science breakthrough of the year, and this is the recognition of again the effectiveness of immunotherapies as treatments for cancer. So what are the advantages of immunotherapy? Immunotherapy is different from chemotherapies and other types of targeted therapies. It offers highly specific killing. So just as the immune system can recognize particular proteins on an infection and eradicate an infection, the immune system can recognize the very specific and particular proteins on cancer cells and can sometimes eradicate those cancer cells. It's not a local therapy. Again, it's not surgery, it's not radiation, it's a systemic treatment, which means it works throughout the entire body. One of the interesting things about the immune system has what's called a memory to it, or durability. So when you get vaccinated as a child against polio, it provides lifetime protection against polio. The same is true of all of the measles and rubella and so forth. So the immune system has the ability to remember these proteins that it's recognizing and provide a long-term protection. against whether it's an infection or against a cancer. And immunotherapy also has an adaptability. So although it's highly specific in its origins, it can learn to recognize other types of proteins. And we think this may be one way to overcome a problem with cancer, is that sometimes individual cells can further mutate and avoid or become resistant to other forms of therapies. So again, in Science Magazine 2014, this was considered the breakthrough of the year. We've seen a renewed interest in the last 4 or 5 years in the use of immunotherapies. And we can see that there was a doubling of abstracts at major conferences over the 3-year period from 2009 to 2012. And there's nearly 1,000 clinical trials ongoing in the United States in various phases in multiple different cancer types. Immunotherapy, it's been proven to be effective. There are various forms have been proven to be effective in various cancer types. These are therapies that engage the immune system. They've been shown to improve survival in a number of different phase 3 cancer trials. And there are now, as of 2015, more than a dozen immunotherapy agents that are approved by the FDA. And the majority of these have been approved just within the last decade. So this is a list of various FDA-approved immunotherapies. And we have everything from, again, the cytokines like interleukin-2 that were approved for kidney cancer. We have monoclonal antibodies. There are a number of things like Avastin, rituximab. The newest thing that's recently been approved are what are called checkpoint inhibitors. We have now 2 approved, one in melanoma and one in, just as of last week, approved in the treatment of a form of lung cancer. And the one therapeutic vaccine, again, this was approved in 2010, and this is specifically approved for advanced prostate cancers. And I think, so this is a Provenge is a form, what I told you is it's a therapeutic vaccine for cancer. So I think it's important to understand the difference between what's a preventative vaccine and a therapeutic vaccine. So most of the vaccines that you get, or all of the vaccines that you get as a child, measles, mumps, rubella, and so forth, these are preventative. And they're designed specifically to prevent you from developing any of those infections. Provenge does not prevent prostate cancer. It's considered a therapeutic vaccine. What's a therapeutic vaccine? A cancer treatment vaccine is designed to treat cancers that are already developed. They are intended to delay or stop cancer cell growth, to cause tumor shrinkage, to prevent cancers from coming back, or to eliminate cancer cells that have not been killed by other forms of treatment. This is a definition, again, from the National Cancer Institute in 2011. This is a schematic of how Provenge works as a cancer vaccine. We have what are called the resting immune cells. These are the white blood cells. Again, these are the same cells that are you think about as fighting infections in your body. These get taken out of the patient. They get sent to a manufacturing facility where they're activated with a particular type of protein. And when these cells become activated, they're returned by an IV infusion into the patient. And they, inside the patient, they multiply, they grow, and they can recognize and attack prostate cancer. Now, there's a treatment window for where people are eligible to receive Provenge. So if you took all men with advanced prostate cancer that is spread beyond the prostate, when you develop metastatic prostate cancer, when you have relatively minimal spread outside the prostate, it may cause no symptoms or it can cause relatively few symptoms. When you have more extensive cancer in the bones and in the lymph nodes, often this causes more significant symptoms. And this is important for 2 reasons. We think that immune therapies work better with more minimal disease, but from a more practical standpoint, Provenge is only approved for men who have either a few or no symptoms, and this is a specific FDA indication. For people who have more extensive disease and more symptoms related to their cancers, there are these other forms of therapies, the chemotherapies, the hormonal therapies, and so forth. So why do we give Provenge? Provenge has been shown in several large phase 3 studies to help men with advanced prostate cancer live longer. So this is not a cure for men with advanced prostate cancers, but it is a way of extending the lifespan of men who have cancers that have spread outside the prostate. This is data from the study that led to the approval of Provenge, and you can see that overall the Provenge reduced the risk of men dying during the study by 22.5% compared to what we call the control arms. And it's not only the average reduction, but even the reduction, again, has the durability. And the durability is a feature of the immune system. And even out to 3 years, you can see there was a 37% risk reduction in dying from prostate cancer. So that's the benefit of Provenge. There are side effects and there are risks to taking Provenge. What's nice about this treatment is that the majority of side effects are mild to moderate. And when they do occur, they tend to last for only a day or two. So what are the common side effects of Provenge? You can think of many of these side effects as being related to the immune system. So a lot of the side effects are as if you had the flu, for example. So the most common side effects, things like chills, back pain, aches in the joints, fatigue, nausea, headache, and fever. In these studies, a smaller number of men experience more severe side effects, and that includes chest pain, irregular heartbeat, dizziness, racing heartbeat, and so forth. Now, only about 1% of men discontinued treatment that were on these studies, and I think that gives you some sense of the tolerability of the treatment, particularly in comparison to other treatments for advanced cancers. So the Provenge is not something we just write a prescription for and the patient goes to a pharmacy. This is not something that just comes out of the medicine cabinet. Each dose of Provenge is actually completely personalized and individualized for each particular patient. It's a custom process, and basically where each patient starts the process by going for a special collection of their white blood cells that's called an apheresis procedure. This is done, for instance, in Red Cross facilities or other types of blood banks. The patient's blood cells get sent to a manufacturing facility, and here on the West Coast, the facility is actually down in Seal Beach, so it's quite close. In this facility, this is where the patient's cells are stimulated. They're basically re-educated now to recognize prostate cancers. 3 to 4 days later, we get these packets back as an IV bag, and we give it to the patients as an infusion. So what happens on the day of the infusion, or what can you expect with Provenge? So each dose of Provenge, it takes about 3 days for once you have your cells drawn or collected. Patients come in 3 days later to our office. The appointments take about 2 hours, and basically we give Tylenol and Benadryl as a form of pre-medication about 30 minutes prior to starting the infusion. The infusion itself is given over about 60 minutes, and then we keep patients in the office for another 30 minutes just to observe them and make sure they haven't had any acute side effects. And another nice thing about Provenge is that it's a very self-limited course. So essentially there's the full treatment can be done in 1 month. This is 3 infusions. They're given approximately 2 weeks apart. So if you can imagine, for each infusion, you have a cell collection. Later in the week, you get the infusion. 2 weeks later, a second cell collection, a second infusion, and finally a third cell collection with the third and final infusion approximately 1 month after beginning it. So it's not a treatment that's ongoing. It's limited to just the 3 infusions over 1 month. So to summarize, Provenge, this is what we call a therapeutic cancer vaccine. It's a type of immune therapy. It's been available as a treatment here at UCLA since 2003, but it's been available as an approved treatment from the FDA since 2010. It's a treatment that's designed to activate patients' own immune cells. to target and attack their own individual prostate cancer. It's been proven to extend survival of men with metastatic, what's called castrate-resistant prostate cancer. It's generally well tolerated. Most common effects are mild to moderate: chills, fatigue, fever, back pain, and so forth. There are occasional more serious adverse events or side effects, and you should discuss those with your doctor before signing up for Provenge. Finally, the therapy is completed in 3 cycles. There are 3 infusions. They're given 2-week intervals. Everything is given at over 1 month period. So again, if anyone has any questions, you can send them in through Twitter, and the hashtag is UCLAMDChat. So we have a few questions. The first: who might benefit most from the prostate cancer vaccine Provenge? This is, again, a treatment that works through the immune system. So you have to be healthy and robust and have a good immune system in order to derive the most benefit. We think people who have relatively small burden of disease outside the prostate are more likely to benefit. And one way we measure that is through something called the PSA. The PSA is the blood test that we use to monitor prostate cancer. And when you looked at the patients, and this was over 1,000 patients that have been treated on these phase 3 studies, the patients who did the best appeared to have the lowest levels of PSA. So although the benefit is across the entire spectrum of patients, different grades, different types of disease spread, a minimal disease burden, and a low PSA seems to have an even better response to Provenge. So in terms of how effective it is, again, this is it's been proven effective across 2 large phase 3 studies. When you say how effective, again, there's a spectrum. The average effectiveness is about 4 to 5 months difference. But again, if you take the people who do the best, who have the minimal disease burden, there's actually over a year additional survival benefit associated with it. So it's quite effective, and it's quite effective with for most people minimal spectrum of side effects. Are there any other immunotherapies for prostate cancer? So currently, Provenge is the only therapeutic cancer vaccine for any cancer. And there are other forms of immunotherapies. We talked about them. They're available for melanomas, for lung cancers, for kidney cancers. But this is the only type of immunotherapy that's an approved therapy for prostate cancer. And it's unique, and again, that this is a therapeutic cancer vaccine, which makes it different from some of the other immunotherapies that are available for other cancer types. Is immunotherapy used with radiation or chemotherapy? So it's not a combined treatment. In fact, the chemotherapies can inhibit the immune system. So one of the things that you get monitored for when you're on chemotherapy is your white blood count. And many chemotherapies will lower the white blood count. And if you have a low white blood count, it may be harder to collect the white blood cells, and it may be harder to stimulate an immune response. So the recommendation that's part of what's called the package insert for Provenge suggests that if you've been on immunotherapies, that you wait up to 3 months before starting treatment. And for a similar reason, things like steroids. If you're on steroids for arthritis or for other medical issues, steroids can also inhibit the immune system. So there is somewhat of a contraindication, and they recommend a window of about 4 weeks to stop steroids if you're going to get Provenge.